New research, meanwhile, has found that serving in Vietnam had a devastating impact not only on the soldiers but also on their families. The wives and partners of Vietnam veterans suffer much higher rates of mental health problems than the general community. Medical reporter Sophie Scott has the details.
Richard Rowe was conscripted and served 12 months in Vietnam. His wife June says for some families living with a veteran can be challenging.
The wives and the children have ongoing problems, often for many, many years. It's like a ripple effect in a pond.
And a new study backs that up. Interviews with veterans' wives found they're suffering mental illness at levels 20 or 30 times higher than the general population.
Initially I couldn't believe it and I repeated the calculations over and over and over. But when I kept getting the same result, you have to stand back with your arms in the air and ring alarm bells.
June Rowe believes that some of the problems stem from how soldiers are trained.
There's a great deal of lack of intimacy, as far as I'm aware, including myself. The boys are trained to, carry on regardless, even if one of their mates has been killed alongside them.
Study author Brian O'Toole found the wives of veterans have significantly higher levels of depression, panic attacks and anxiety disorders.
More than 50% of the wives have had a history of major depressive disorder, and that this history of major depressive disorder is related in our data to veteran combat.
June Rowe isn't surprised, saying many wives are trying to help their partner deal with mental illness.
They suffer sometimes very high degrees of anxiety, and it's very difficult living with someone like that. You often feel like you're walking on eggshells.
Researchers will now turn to the fate of veterans' children to see how they've been affected. Sophie Scott, ABC News.